Sadly, we lost another Albany County resident last night. She was a woman in her 70s with underlying health conditions. My condolences and prayers go out to the family, to the other 115 people that have passed away. And, I know it's difficult times for everybody, especially for families that lose loved ones. And it's a little bit different now when you go to a wake or a funeral, and they're starting to open it up a little bit more. And I went to Camden Funeral Home for a friend of mine, childhood friend that we lost the other day. And it's kind of like going through the airport, the way they weave you in, but they're letting it small groups to come in, so that's a good thing. So people can kind of say goodbye to someone that they lost in their life, but in a safe manner. To all the 116 people that we lost in this county now, again, my condolences and prayers go out to each and every one of you and to your families through these difficult times. As of today, our mobile testing sites continue to be strong in, working within the community, within a partnership. So Whitney Young sites have tested 1,992 people with 223 positives. That's a positive rate of 11%. And I want to thank my office for helping getting this going, and to Liza Whalen, Department of Health, all working together to do something that hasn't been done around the state, because it really helps us get to that underlying issues in certain communities that have issues and that this has affected differently. It's going to give us data to go forward, to address, to continue to address, even when this crisis is over with. Some of the good stuff, as we continue to aggressively test and move forward, we have 1,809 people now positive with the coronavirus. That's only up 4 from yesterday. We have 539 people under mandatory quarantine. That's down 3 from yesterday. And we have 5 people under precautionary. That's down 1 from yesterday. And with all the protests going on and everyone being out, it's good. These are good numbers. We've been tracking the people from that showed up at Warren Street, the 78 protesters that came to get tested. The test results aren't back. You think now would be a little bit easier with things coming back and we get it back more rapidly, but we're staying on top of that to see where them numbers are at, and we continue for people to please go out and get tested, especially if you're out there in the community, so we can keep this going down in the direction that we're going and keeping the curve down. Right now we have 5,014 people that have completed quarantine. That's up 14 more people that have completed since yesterday, and we have 1,526 people tested positive for the virus that have recovered. That number stays the same as yesterday. There are now 12 people hospitalized with a hospitalization rate of 0.66%. Of those who have tested positive, yesterday that rate was at 0.77. Also good stuff. We have 0 people in our ICU for the first time, but unfortunately the person that we lost last night was in the ICU. So it's still sad news. But the 5-day average has been down to 6.2 new positive cases each day. Yesterday it was at 6.5, which is good. But again, I'm telling everyone, we have the mobile testing sites. We have the testing sites at UAlbany drive-thru. We have Seth Q Arena. We have the Rite Aid in Gilliland, in Colony on Central Avenue, and we have the Priority One in Gilliland. So please, as always, go there, get tested, and make sure that you continue to do the right thing. We have our free walk-up testing site at 20 Warren Street today until 11 a.m. You don't need an appointment, so if you're watching this or listening to this, you can go to Warren Street today and just show an ID. If you don't have insurance, don't worry about it. We're going to pay for that too, so please do that. So more guidance is coming out on phase 3 and some of the things that changed with phase 2. We put that out yesterday, but one of the things in the control room that they brought up was I kind of did notice driving around that some places got creative. I know there was outside dining, and they went into street, which is great, and I encourage every mayor and town supervisor to close certain streets down to expand that out so people can enjoy the fresh air and have their favorite food. I did see some tents go up, which kind of surprised me, and I'm like, I don't think that's outside dining, but it was approved. So they said they can have a tent out in their parking lot as long as all the sides are up and there's fresh air going through, and the tables are 6 feet apart, or people at a table are 6 feet apart, and then the tables are spaced out appropriately. So which is great news that they put out yesterday. But restaurants, just to get ready, so we have the guidance this time out, can start at 50% maximum capacity, not including customers that are in the count. Outdoor limit of the number of tables, like I said, they have to be safely, appropriately arranged, so there's maximum distance between each table. And indoor and outdoor tables with seating for customers must be, again, separated by a minimum of 6 feet in all directions. So, which is all good stuff. And these are good things in the direction we're going into, and I'm hoping that the governor lifts us before the 17th of June, because if our numbers continue this way with the constant protests going on and everything in the community, we did the right thing. And I say this to the people that stayed home it'll be 14 weeks this Friday. For the people that stayed home and did the right thing, thank you, thank you, thank you. We can't appreciate what you did, and trust me, it's not easy staying home. It's not easy trying to stay away from people when we're a society that likes to gather and be with people. I get it, but thank you for what you did, because you did keep our numbers down. So seating in bar areas, they can sit at a bar, but they have to be spaced out 6 feet. So if you got a small bar, do the math. You might only be able to have 3 people at your bar. It's one of the questions we've gotten from restaurant owners. And I said, well, right now it's 6 feet apart. So if you got a tiny bar, it's probably not going to work for you. And having separate entrances and exits for consumers and employees. So all this stuff you can find online, for phase 3. You can go to the New York State dashboard. You can go to our website. You'll get the guidance for phase 3, which is great, because everyone knows when we were going to phase 1, guidance was slow. Guidance was slow in phase 2, and they continue to evolve and change as things continue to change and numbers stay good. So this is all good stuff going in the right direction. But Dr. Whalen.
Thanks, County Executive McCoy. So I think the numbers continue to go down. This is good news, and it is indicative of the effort that everybody has put in flattening the curve. We've been successful, and this is allowing us to start opening up again. I do want to encourage people to continue to be vigilant, to continue to practice the techniques that we've been talking about for weeks to prevent infection going forward, and we will continue to follow along with the numbers. As the county executive indicated, there's guidance for phase 3 that has been put out, and we also learned this morning that special education services and instruction may be provided in person this summer. And there is some language on how speech therapy can be provided. So as all of these services and programs become available, we look forward to a slow return to the new normal, but it's still going to be very important for people to protect themselves going forward.
Thank you, Dr. Whalen. And before I forget, we had a lot of questions on sports. What we were told in the control room, we put out yesterday what sports are allowed to come back, and I did notice some camps look like there are camps running in the city. You have to have insurance. If you go against an executive order, you better make sure the insurance carrier covers that incident. God forbid a kid gets, the coronavirus or something happens, it's going to be liable of the insurance company. So I wouldn't recommend it until it's signed off on by the governor, but they're just letting people know that. Also, the other good thing was that I asked for approval to move our nursing home staff to 1 day a week. This was kind of crazy doing them 2 days a week to get tested. So they agreed yesterday that now that we're in phase 2, anyone in phase 2 in the state only has to test their workers at their nursing home 1 day a week. So to the workers out at my nursing home, I know they didn't like every Monday and Friday, but now at least it's 1 day a week for now, and hopefully when we get into phase 3, then we'll stop and I'll do it as needed. So just to let that everyone know about that. So again, one last thing I do want to bring up, the LEADS. If people don't realize what that is, it's a Law Enforcement Assistant Diversion program that we launched in 2016 in a partnership with the Sheriff Apple and then I think it was Chief Cox and Mayor Sheen. But we've put in for a grant for $900,000 from the county, and hopefully you'll get to the county legislature soon. We'll be running more. We do 90% of the program, but we're going to be running more of it with the agreement we made with LEADS. But we are, so I put this out there to everyone, we are looking for a full-time candidate for program director position for the LEADS program. So please, if you're interested, reach out to us, and it's the program director position. And I'm hopefully getting to the legislature soon, the $900,000 grant that we'll be receiving hopefully soon from LEADS to continue this program going forward. As always, please, if you have an issue, call our mental health number. As always, it's available 7 days a week. And the number, as always, is it's from 8 a.m. to 8 p.m. The number, I really should have this number down pat by now, 518-269-6634, 518-269-6634. Our 24-hour sexual assault hotline number, as always, is 518-447-7716. And our United Way number with our partnership with Pete Gannon at United Way, 211. And our hotline number for New York State, 188-364-3065. I've gotten a lot of questions. People like me doing this daily briefing every day, but I will say this: we have to get back to the norm, right? And we're, when we get into phase 3 and start bringing more non-essential workers back to work, we have to get back into the groove of things. And government has a lot of roles. This is just one of them. A lot of roles in the health department. This is just a snapshot. So I'll be evaluating whether or not I'm going to knock this down to 2 days a week or just have press conferences when needed, if the information changes. But as our numbers are staying steady and we're going in the right direction, and if we get into phase 3 on Wednesday, probably start next week, I'll probably do 2 days a week, not unless something out of the ordinary happens or some guidance that we have to get out right away.